It's now really clear that we have a mental health crisis on our hands as a result of COVID-19. Surveys now show that 50% of America says that COVID-19 has affected them psychologically, and a recent article published in Newsweek indicates that 72% of Americans say that they're hitting a mental breaking point if stay-at-home orders continue until June. So what are we supposed to do to cope with this? Because COVID-19 isn't going away anytime soon, according to our health experts. So here are 12 ways to beat the COVID blues. Nation being addicted.
Dr. Terry Shintani, Director of Preventive Medicine at Florida.
Hi, this is Dr. Shintani for your health. For more quick videos on the virus and how to stay healthy for 120 years, please consider subscribing to this channel and click on the bell for notifications. And click the share button and share it with at least 2 or 3 friends by email or social media. The economic impact, the effect of being shut in, and the changes in our lives are bound to produce stress, anxiety, and depression in at least some of us. So here are 12 ways to beat the COVID-19 blues. Number 1, eat healthy foods and stop eating junk food. One bad habit that can be caused by the COVID-19 stay-at-home order is that people start to eat takeout more often. For some people, that means eating lots of fast food and snack foods. This is not a good choice. Too much sugar and processed foods can cause mood swings and depression in a lot of people. What we should be doing is using this as an opportunity to cook healthy food at home and not eat out so much, and eat real food such as whole grains, vegetables, fruit, and legumes. People will be surprised how good they feel when they try to eat real foods. One surprising finding is that coffee can actually help prevent depression as long as it doesn't affect sleep. Number 2, exercise. Another problem with staying at home orders is that exercise is more difficult. Exercise is a known antidote to anxiety and depression. Exercise can elevate your mood because it increases blood flow and allows the body to get rid of toxins, and it helps increase circulation to the brain. It can also cause a release of chemicals such as catacholamines and endorphins, which can make you feel really good. Studies show that exercise is a well-established way to beat depression. Number 3, vitamin D and sunlight. I think it's important that we make sure that we have enough vitamin D and sunlight. One of the unfortunate mitigation measures of COVID-19 is the stay-at-home order. We need sunlight to produce vitamin D, and staying at home could cause a decrease in our vitamin D levels. Low vitamin D is associated with depression. If you can't get enough sunlight, then make sure you're taking an adequate amount of vitamin D through a supplement. And remember that vitamin D boosts immunity against COVID-19, as I mentioned in my previous video about 10 ways to boost your immune system. Number 4, hormone balance. Hormone balance can profoundly affect your mood. I've gotten a lot of people out of depression simply by balancing or optimizing their thyroid hormones. For some people, having a normal thyroid level isn't quite enough, and optimizing the thyroid levels can make a big difference. Also, balancing progesterone, estrogen, or testosterone can also make a difference. Nutrition can affect hormone balance, so make sure you're getting enough vitamins and minerals such as iodine, zinc, and vitamin D, and avoid eating too much animal fat. Be aware that for hormone replacement therapy, you do need to see a physician in order to get your hormone levels tested and hormones prescribed. One important thing to remember is to use bioidentical hormones and not synthetic analogs while using hormones. Number 5, sleep. Good sleep is the cornerstone of stress management and the prevention of depression. In my previous video on 10 ways to boost the immune system, I pointed out that too much or too little sleep can impair the immune system. The same holds true for depression. A good amount of sleep is somewhere between 7 to 8.5 hours of sleep. Any less or any more could actually contribute to depression. Number 6, watch your medication. For some people, taking medications such as sleeping pills or even antidepressants, blood pressure medication, cholesterol medication, or proton pump inhibitors and other medications can contribute to depression. So be aware that some depression can be caused by your medication. If you're on prescription medications and feeling the blues, you might want to talk to your doctor to see if adjusting your medicines can help. Number 7, make sure you have a good energy environment. One of the negative things about COVID-19 and staying at home is that people tend to sit in front of the computer too long. If you do that, make sure you get blue blocker glasses or blue blocker screens for your computer, laptop, or tablet, because the blue light from these devices can actually contribute to fatigue and decrease in mood. If you have Wi-Fi at home, this may also be a problem, and it's a good idea to turn off your Wi-Fi when it's not in use. The flip side is that you can get good energy from a system that we're testing at our offices called the Energy Enhancement System. This sends out a beneficial bioscalar energy field that can have an antidepressant effect. See alohanetics.com for more information about using energy fields to boost your mood and your energy level. Number 8, social support. Make sure that you reach out and keep in touch with friends and family, either by internet or phone, or even in person if you can maintain physical distancing. Having a social support system is important to a healthy mood and preventing depression. If you have problems, for example, a lot of people have financial issues due to COVID-19, try to deal with your situation one thing at a time. And if you can't handle it, don't be afraid to reach out for help if you need it. In this tough environment, people, including creditors, tend to be a lot more understanding and willing to help. Number 9, reframing. Reframing means to change our perspective so that the situation looks more as an opportunity than as a difficulty. For example, you can look at the changes brought on by COVID-19 as an opportunity to cook healthy at home or to be more with family. Or for some people, they enjoy being on their own and dealing with personal or spiritual issues on their own. One of my friends who's an environmentalist said that just look at this situation as Mother Earth catching a cold and cleaning herself out. Number 10, meditation. Meditation is known to be helpful in reducing stress and helping people to cope with depression. Research done at Harvard University indicates that regular meditation helps the brain to deal with stress and prevents depression. Number 11, humor. Don't forget to get a good laugh every day. For example, I heard that there will be a baby boom in 9 months from now because people have nothing better to do than make babies. What will this generation be called when they're in high school? Well, they could be called quarantines. Number 12, prayer. Prayer has been used for millennia for people who are going through difficult times. Now there is scientific evidence that prayer actually helps with depression. In a randomized controlled study published in the International Journal of Psychiatry and Medicine, it was demonstrated that prayer had a significantly positive effect on depression scores compared to those who did not pray. There are many more things you could do to fight depression, but starting with these 12 will help you fight the COVID-19 blues. For more tips on coronavirus and how to stay healthy for 120 years, please look for my previous and upcoming videos by subscribing to this channel, clicking on the bell for notifications, and if you would, please consider sharing this by clicking the share button and share it with family and friends. I thank you for watching. This is Dr. Shintani for your health.